first year I was able to work on a neuro ward in an adult hospital, and that was really specialised and really intense, and I was able to pick up a lot of experiences with patients with neuro defects, trauma, injuries and stuff. I also did mental health placement as well. That was really challenging, but I really enjoyed it.
When I was on the burns unit, I came across quite a few patients that had severe burns. One of the ladies that came in had completely burnt herself from head to toe basically, and I got down to go and visit her in A&E when she first was flown in by helicopter, and I went down with one of the nurses and I was able to witness emergency care for this lady, and it was a very bizarre experience, very out-of-body experience, but it was amazing how one day I might be able to impact someone's life like that.
A lot of my children's placement have been working at local children's hospitals. I've generally been on a surgical ward throughout all my placements, but it's allowed me to experience a large variety of conditions and surgeries that children come with. I've been able to go down and watch stoma formations, cleft lip palate, surgical treatment, and it's been really good. Being able to work with the children and the family, seeing them from admission to discharge, and if they have any follow-up as well, which I've been able to see. Surgical wise, it's been really nice to be able to go down to theatres as well and to watch the different surgical treatments and stuff, so it's been really good.
I've been on oncology, been on clinical decisions, A&E, urology, district nursing, mental health nursing, all of which were fantastic and have really helped structure me and make me develop professionally. I think my favourite was clinical decisions because it was fast-paced, lots of action, and you see a huge range of things. But then again with oncology, which was like a long-term palliative placement, that was very hard, and I found that although physically I could keep up with the fast pace, emotionally it was very difficult. And I think with this course you're challenged in every sense.
I think my highlight from being at Birmingham was when I was working on a liver surgical unit, and I was lucky enough to be able to get involved in a liver transplantation. It was a very unique experience because the patient was donating part of his liver to his younger sister. So I was able to clerk the patient in, go down to theatre, watch the surgery, take part of his liver out, and then from there I actually went with the transport to take the liver to the children's hospital. So went along Edgbaston Road, blue lighting in an ambulance was great fun, and then was able to watch then that organ be transplanted into a young child. It was a really moving, emotional experience. I was in contact with the family the whole time, so they knew that I'd seen the whole process from start to finish.
And I've just been on a surgical ward, and I do still have a real interest in surgery. And I'd quite like to work, I'd like to stay at home, work in the children's hospital in Birmingham hopefully, because I want a hospital specialised to children, and see what I want. Surgery is definitely an option for me, but I've still got 5 placements left, and it was on a placement that I found my love for surgery, so I still know that I could definitely find a love for a different part of children's nursing, and that's what's so exciting about doing this course. You experience different things in every placement, and one day you'll have an amazing day at placement and think that's something I really want to do. And then 2 months later you'll be in a different placement thinking, oh no, but that's something that I really want to do.
It was really fulfilling and rewarding. It was a definitely once in a lifetime experience. I was so lucky.